He has come to us with the swelling at the nape of the neck on the posterior aspect since 15 years. There is no pain in the swelling. However, the swelling is gradually increasing in size and it has attained the present size. He consulted various physicians earlier and they advised him some surgical procedure. But since it was painless and it was not causing any symptom, and he is also a known diabetic, the family members refused to get operated. However, since the size has increased significantly, he has been brought to us to see what is the diagnosis and how is the plan for management. So whenever you get a patient like this, first of all, the first thing you have to ask is his duration. Because any swelling in this area, in the midline, especially at the back, is very, very important. Because the spinal cord starts from here and ends at the back. So any swelling which is there in the midline of the back is a significant swelling. And it should not be ignored. Otherwise, it can cause disaster. So, we have to find out since birth, or it is acquired. In the history, we have come to know that it is for last 15 years. So that is also a significant period, and in that 15 years, it has grown to this particular size. Now, there is no pain, there is no ulceration, no skin changes, and it is, आपको इससे कोई परेशानी होती है? He is not very much affected by this swelling. जी? He says that when he is lying down at the back, he has some discomfort, but it is painless. So now we will see what is this swelling. So inspection, we can say that the swelling is at the back of the neck and around 15 centimeters vertically and about 12 centimeters transversely, and it is say oval in shape. And there are no skin changes, there is no punctum, there is no excoriation, there is no vascularity, there is no venous engorgement. The surrounding areas also do not show any sign of inflammation. So it appears to be a simple benign swelling on inspection. And now we will do the palpation. The procedure is first you have to see for local temperature. So for local temperature, you have to see the temperature of the exposed area of the skin and then go to that swelling. So this local temperature is not raised. The second thing is to see for tenderness. For that you will press at the swelling and see if there is any wincing or not. So there is no wincing, so it's non-tender. So local temperature is not raised, it's non-tender. Then you see the size, approximate size, but you will confirm it by an inch tape, and approximately it's appearing to be around 15 centimeters, and here these two ends would bring it to 12 to 13 centimeters. So vertically it is 12 centimeters, 15 centimeters, and transversely it is 12 centimeters approximately. Then you see whether the swelling is fixed to the skin or not. So you will do the pinching test. So you are, and not only in one place, at multiple places, to see whether it is free from the skin. So it appears to be free at some places, but at other places it appears to be fixed also. Here it is free, but here it is a bit fixed. So now, then you see the mobility, general mobility, consistency, it is firm and soft. In some areas it is fleshy, firm, at other areas it is very soft. And it can be moved from one side to the other. Then you have to see transillumination. Light off karo, Now we pass the light from that side and try to see where there is transillumination or not. So no transillumination, so transillumination negative. But if it was transillumination positive, it would have been significant. Why? Because there is CSF collection, and then we'll discuss the differential diagnosis of this swelling. Otherwise, there is no local गर्दन पीछे करिए, mobility of the neck, आगे झुकाइए, आगे करिए, इस तरफ मेरी तरफ करिए, हाँ, उस तरफ करिए. So the mobility of the neck is also normal. It's not affected. So now, once you have a swelling like this, you have to think of the possible differential diagnosis. So the possible differential diagnosis, you must start with first the dermoid cyst. 15 years, history is there. It may be from much earlier. So dermoid cyst is one possibility. Second possibility is encephalocele. But as the transformation is negative, it is very unlikely. And there are no neurological effects like lifting of the hand, movement of the limbs, movement of the neck, they are not affected. So encephalocele is also a remote possibility. Then what are the other swellings in this area? Cystic hygroma. Cystic hygroma is a lymphatic cyst. Again, translamination is strongly positive in a cystic hygroma. We have seen that the translamination is negative. So it is not a cystic hygroma either. So now what is left is only fibroma or lipoma. So it can be a lipoma, it can be fibrolipoma, because at some places it is soft and some places it is fibrous. So the most likely diagnosis in this case is fibrolipoma, and most likely it's a benign swelling. So now what is the plan for this management? The plan for management is we can get an ultrasound, although it is not mandatory, but that will show what is the content of this swelling. Because some of these areas where it is cystic may be fluid, and where it is solid areas it will be different. So ultrasound will tell us it is a solid cystic swelling, or it is a completely cystic swelling, or it is a solid, throughout solid swelling. So three types of differential diagnosis will appear. In a solid cystic swelling, it will be more likely to be a dermoid cyst. If it is complete cyst, then it will be a cystic hygroma. And if it is having translamination, positive was not there, but solid structure inside, which can be neurons, so it can be an encephalocele. So the purpose of getting an ultrasound is not to make a diagnosis, but to rule out difficult diseases which can be disastrous during surgery. So we can rule out cystic hygroma, we can rule out encephalocele, and we can rule out dermoid cyst. So what is remaining is a simple procedure. It is a lipoma or fibrolipoma. So another investigation which is possible is fine needle aspiration cytology. So that will show what is the pathology, if it is there, but that is not necessary, because once you intervene there is likely to infection. So the final procedure would be excisional biopsy. So we do a surgery, remove the cyst and send it for histopathology. So the final diagnosis after elimination of all differential diagnosis is a fibrolipoma in this case. Thank you very much.